Dentistry is a branch of medicine that involves research, teaching, and administration. Computers can handle a large amount of such data. The patient care is based on the generation, storage and manipulation of information. Digital dentistry allows you to carry out dental procedures more efficient than using mechanical or electrical tools. Digital dentistry helps in the design of dental restorations, crowns and fixed partial dentures. FPD frameworks can be constructed. Digital dentistry improves productivity and quality of dental care. It is used in collecting, sorting and searching data. The efficiency and productivity are increased through computer appointments, recall and practice analysis programs. Computers can be used in the field of dentistry. They are used in the administration field in dental clinics, hospitals and dental institutions. Computers are used in patient records storage and retrieval, patient evaluation, examination and treatment planning, patient motivation and awareness, and appliance designing using CAD and CAM techniques. Computers are used in radiovisuography, RVG, technique, clinical diagnosis and treatment planning, storage of patient photographs, radiographs and study models, computerized imaging techniques, computerized cephalometrics and growth prediction. Digital radiography can be stored on the computer easily and can be transferred to different dentists or orthodontists for referrals. It reduces radiation and time. Film sensors are less thick and rigid than digital sensors, so they provide the patient with better comfort when the X-ray sensors go into their mouths. Film presents superb picture quality. It can withstand heat sterilization. Film X-ray photos cannot be altered. Cone beam computer tomography has seen rapid growth due to decreased costs. It offers many options to choose from. An increased number of general dentists placing implants, and decreased radiation. It is quickly adopted by most specialties and becoming the proposed standard for many surgical procedures, such as implant placement, third molar removal and endodontics. Lasers can be used in every field of dentistry. Diode laser offers lower cost areas of digital dentistry to adopt, and it is very easy to use. It is used in periodontics, endodontics, surgery, and prosthodontics. CAD refers to computer-aided design, CAM refers to computer-aided manufacturing. All CAD/CAM systems consist of a digitization scanner that transforms geometry into digital data that can be processed by the computer. CAD/CAM systems process data, and depending on the application, they produce the data set for the product to be fabricated. CAD/CAM is faster, more economical, predictable, consistent and relatively accurate. All components of the CAD/CAM system are located in the dental surgery. Fabrication of dental restorations can take place at the chairside without a laboratory procedure. CAD/CAM saves time and offers the patient indirectly fabricated restorations at one appointment.